What if I told you that your dog experiences the world in a way you can barely imagine? Right now, as your dog walks past their bowl and turns away, they are not being difficult. They are not punishing you. They are telling you something. And today you are going to learn exactly what that something is. Because here is the truth that most dog owners never discover. Feeding your dog is not just about nutrition. It is about science. It is about senses. And most of all, it is about connection. Let us start with the most important thing you need to understand about your dog. Your dog does not taste their food first. They smell it first. While humans have approximately 5 to 6 million scent receptors in our noses, a dog has between 220 million and 300 million. That means, depending on the breed, your dog's sense of smell is between 10,000 and 100,000 times more powerful than yours. Pause and let that land. When you open a can of food in your kitchen, you smell something pleasant. Your dog, sitting in the next room, is receiving a full chemical report, identifying every single protein molecule, every fat compound, every trace of moisture in the air. Their entire appetite system is built around this olfactory intelligence. This is why the temperature of your dog's food matters far more than most people realize. Cold food from the refrigerator suppresses the release of scent compounds. Warm food, on the other hand, triggers the release of volatile organic compounds, what scientists call VOCs, which are the aromatic molecules that activate your dog's appetite response at a biological level. This is not a trick. This is chemistry. When you gently warm your dog's food to body temperature, which is between 38 and 39.2 degrees Celsius, or 101 to 102.5 degrees Fahrenheit, you are essentially turning up the volume on a signal their brain is already listening for. A dog's appetite is the heartbeat of their health. When that heartbeat slows, when they begin to turn away from the bowl, something important is trying to get your attention. Let us make sure you are listening. Now that you understand why smell drives your dog's appetite, let us talk about how to use that knowledge. Technique number 1. Warm the food. This is the single most effective and scientifically grounded technique you can use. Take your dog's food, whether wet, dry, or mixed, and warm it gently in the microwave for 10 to 15 seconds only. Before you serve it, always test the temperature with the back of your hand or a clean finger. The food should feel warm, not hot, matching your dog's own body temperature. Here is the critical warning. Never serve steaming hot food to your dog. High heat can cause thermal burns to the sensitive tissues of their mouth, tongue, and esophagus. The goal is gentle warmth, not cooking the food a second time. That short burst of warmth releases the volatile aromatic compounds that stimulate your dog's olfactory system, awakening an appetite response that cold food simply cannot trigger. Technique number 2. Soften the kibble. Did you know that dental disease affects 80% of dogs over the age of 3? This is not a rare condition. It is practically universal in adult dogs, according to data from the American Veterinary Medical Association. If your senior dog or middle-aged dog has begun turning away from hard kibble, it may not be boredom. It may be pain. Gingival sensitivity, periodontal inflammation, and missing teeth make crunching through dry food a genuinely uncomfortable experience. The solution is straightforward. Add warm water to the kibble and allow it to soak for 5 to 10 minutes until the pieces are soft and easy to chew. This makes the food significantly more accessible and comfortable for dogs dealing with dental sensitivity. One important safety note: do not leave soaked kibble sitting at room temperature for more than 30 minutes. Once moisture is introduced, bacterial growth, including Salmonella and Listeria, accelerates rapidly. Always discard uneaten soaked food after half an hour and prepare fresh portions. Technique number 3. Add flavor enhancers. Low-sodium broth, either beef or chicken, can significantly increase your dog's interest in a meal they have been ignoring. It adds both moisture and palatability, making food more aromatic and more appealing. However, this comes with an absolutely critical warning that you must memorize. Never use regular store-bought broth without reading the label first. Commercial broths almost universally contain onion powder, garlic powder, or both, often listed in small print under natural flavors or spices. These ingredients are severely toxic to dogs. Always choose broths that are explicitly labeled as containing no onion or garlic, or make your own plain broth at home using only meat and water. Why are onions and garlic so dangerous? Both alliums contain organosulfur compounds, particularly thiosulfate, which causes a process called Heinz body formation inside your dog's red blood cells, essentially destroying the cell's ability to carry oxygen, leading to hemolytic anemia. Garlic is particularly concentrated, carrying up to 5 times the toxicity of onions by weight. Certain breeds, including Akitas and Shiba Inus, show even greater genetic sensitivity to allium toxicity. This is not a mild sensitivity. This is a genuine medical emergency if ingested in sufficient quantities. Always check every label every time. Sometimes the most effective way to restart a dog's appetite is to introduce something new on top of a familiar base. Safe, vet-approved protein toppers include cooked shredded chicken or turkey, always skinless, boneless, and completely unseasoned. No salt, no pepper, no butter, no seasoning of any kind. Hard-boiled egg, plain, unsalted, chopped finely. These protein additions tap into something called dietary neophilia, your dog's natural evolutionary drive to explore novel flavors and textures. Ancestrally, variety in diet helped dogs maintain a balanced intake of nutrients. When a familiar, boring smell is topped with something new and protein-rich, it triggers genuine biological curiosity and appetite stimulation. 2 warnings you must never skip. First, remove all bones from any cooked protein before serving. Cooked bones, unlike raw bones, become brittle and splinter easily. Bone splinters can cause pharyngeal trauma, esophageal foreign body obstruction, or intestinal perforation. This is not an exaggeration. Second, remove all poultry skin. Poultry skin is extremely high in fat. When a dog ingests a large amount of fat rapidly, it can trigger the premature activation of digestive enzymes within the pancreas itself, causing acute pancreatitis, a painful, potentially life-threatening condition requiring immediate veterinary care. What bowl boredom actually is. You may have heard the term bowl boredom. The scientific name for this phenomenon is food habituation. When a dog is exposed to the same sensory input, the same smell, the same texture, the same temperature, day after day, their olfactory and appetite systems adapt and stop responding with the same enthusiasm. This is not stubbornness. It is neuroscience. The brain is doing exactly what it is designed to do, filtering out repetitive, unchanging stimuli. Rotating textures, temperatures, and safe toppers provides the novel sensory input that reactivates the appetite response. The science of hand feeding. If your dog is anxious around meal times or has gone through a stressful experience, illness, a move, a change in household routine, hand feeding can be a powerful intervention. Hand feeding works because it eliminates 2 key stressors: resource anxiety, the worry about whether the food will disappear or be taken away, and environmental pressure, the experience of being left alone with a bowl in an unfamiliar or stressful context. When you hand feed, you activate the secure attachment bond between you and your dog, transforming mealtime into a cooperative, low-stress, trust-based interaction. Mealtime should be a celebration of your bond. Here is something that surprises many dog owners. Your dog knows when you are worried about them. A landmark study from Budapest University confirmed what many pet owners had always suspected. Dogs detect shifts in human cortisol and adrenaline levels through olfactory pathways, and they respond to anxious vocal frequencies in ways distinct from how they respond to calm, neutral speech. What this means in practice is this. If you stand over your dog's bowl with anxiety written on your face, checking, encouraging, hovering, your dog registers your stress and may interpret the entire situation as dangerous or high pressure. The result? They walk away from the bowl. Try placing the food down calmly, walking away without comment, and allowing your dog to approach in their own time. Some dogs eat significantly better when given privacy and quiet, especially in a calm environment without television noise, other pets circling nearby, or children moving unpredictably in their peripheral vision. Your calm is a gift to your dog. Your love is the foundation of their health. At this point, you have warmed the food, softened the kibble, added safe toppers, introduced hand feeding, and created a calm environment. And yet, your dog is still not eating. Here is what you need to know next, and this information could save your dog's life. The 48-hour rule, with one critical exception. For a healthy adult dog, veterinarians generally agree that a complete refusal to eat becomes a medical concern after 48 hours. Prior to that threshold, a single skipped meal or even a day of reduced interest is not necessarily cause for alarm, provided the dog is otherwise behaving normally. However, and this exception is non-negotiable, if your dog is a puppy, a senior dog, a toy breed, or a diabetic dog, the window is significantly shorter. These animals are at serious risk of hypoglycemia, dangerously low blood sugar, within 24 hours of not eating. Do not apply the adult dog rule to these vulnerable populations. Emergency symptoms requiring immediate veterinary attention. Do not wait. Do not try one more technique. Go to your veterinarian immediately if your dog displays any of the following: persistent vomiting, more than twice within a 24-hour period. Severe lethargy or ataxia, unusual weakness, unresponsiveness, loss of motor coordination or difficulty standing. Clinical dehydration, check your dog's gums. They should be moist, pink, and slippery. Dry, tacky, or pale gums are a warning sign. Note: the traditional skin test for dehydration is not reliable in senior dogs, obese dogs, or very thin dogs due to altered skin elasticity. Gastric dilation volvulus, GDV, a visibly bloated or distended abdomen combined with unproductive retching, attempting to vomit but producing nothing. This is a time-critical surgical emergency. Every minute matters. Pale or cyanotic gums, white or bluish gums indicate severe anemia, circulatory shock, or internal hemorrhage. Labored or rapid breathing, dyspnea unrelated to heat or exercise, blood in vomit or stool, hematemesis or hematochezia require immediate evaluation. Sudden unusual behavior, hiding, aggression, continuous whimpering, or complete personality change. Do not minimize these symptoms. Your instinct that something is wrong is almost always correct. You found this video because you love your dog. You are searching for answers at an hour when most people would have simply put the bowl away and assumed everything was fine. That kind of attention, that devotion, is already making a difference. Most cases of temporary appetite loss in healthy adult dogs resolve within 24 to 48 hours with the techniques we have covered today. Warming food to body temperature to release aromatic compounds, softening dry kibble for dogs with dental sensitivity, adding safe, toxin-free broth or protein toppers, rotating textures to address food habituation, hand feeding to reduce stress and activate secure attachment, creating a calm environment free from your own visible anxiety, allowing privacy and patience, letting your dog come to the bowl in their own time. These are not desperate measures. They are science-backed, veterinarian-aligned strategies rooted in how your dog's biology and psychology actually work. And through all of it, remember this: your dog looks to you for safety. They read your face, your posture, your breathing. When you approach their care with calm confidence rather than visible panic, you are already healing something. Your devotion is the light that guides them home to health. If your dog's appetite does not improve within 48 hours, or immediately if you notice any of the emergency symptoms we discussed, please contact your veterinarian. You know your dog better than anyone. Trust that knowledge. If this video helped you, share it with another dog owner who might need it. Subscribe for more science-based, veterinarian-aligned content about your dog's health, behavior, and well-being. Your dog is lucky to have you.